Welcome to Rotimi Health TV. Today's episode, want to be examining infertility, or generally we assume to be fertility. What is the definitions of infertility? Infertility happens to be a condition when a couple, husband and wife, who are got married legally and they are having sexual intercourse with each other without any omission and they are living together for a period of 12 months. If this thing cannot procreate, I mean, if you cannot consummate, medically we consider it to be a problem of infertility. We now have primary and we have secondary. Primary infertility is somebody who had never been pregnant before, while secondary infertility is somebody who had probably you have been you have a baby before or you have been pregnant before, you had an abortion, and there is a problem. These are secondary infertility. But to go straight to the point of our understanding, infertility happens to be the major problem the youth, I mean, we young men of today faces. Like I told you, it is a period, a condition when you cannot be able to produce a child after marriage after 12 months. Now, what are the principal causes of all these things? The principal causes are being highlighted into three categories. The first categories are peradventure you have an infection. The second one we call it obstructions. Then the third is hormonal imbalances. I will take one after the other so you will understand me better. When a patient or a person cannot have a child due to infection, what type of infection am I talking about? Most women mistaking that toilet infection is. I'm not talking about this. Most of these infections are chronic PID, pelvic inflammatory diseases. You have to be managed properly with both bacteriostatic and bactericidal antibiotics. If these things are not done, you are a failure. And this thing have to be done radical because most of our women would always deceive a doctor. This thing just started, and it's not true. The second categories are obstructions. What do you mean by obstruction? So something is either blocking the reproductive organs or something is growing there. Among them, we have fibromyoma, what we call fibroid. Then there's something you have this ovarian mass or whatever. These are obstructions. And there are even some who had have an abortion before and probably get and there are situations where you even have some retained fetus skeleton inside the uterus of a woman. And provided there is any foreign body in your uterus, it serves as an automatic family planning. Above all this, if this obstruction is there, surgically we remove the fibromyoma, understand? And I have given a topic somewhere to enlighten people about fibromyoma. You don't need to travel to Asia, Europe, to do a surgery of fibroid, please. Why? African women, because they are very, very productive in our because of our gene, our androgen hormone are always very, very high. These have been traced by research that these are the things that triggers most of these fibromyoma. And it has been observed that in those days, I say in those days, I'm talking about 20 years back, that if your uterus has never carried a pregnancy for a period of at least 35 years, something will surely grow in your uterus. That's one point. But if you have a problem of fibroid, please, we have something we call disease epidemic. Disease epidemic is the problem of a particular disease that you can experience among your areas. I mean, okay, this problem is common among the Yorubas, or it's common among the Igbos, or it's common among the Africans. So, like general study says, among African Americans and Africans, These are where this thing is very prevalent. Now, what do you do? Your doctors, I mean your surgeon that will do it, there are two categories. We have something called tourniquet method. Now, the surgeons must, you must discuss with your surgeon. I want to be pregnant. I want to be pregnant. The surgeon will definitely know that he's removing the fibromyoma and correct it to make sure that your uterus is permissive to have a baby. Because if you do not do this, there are some uh, fibromyoma, even almost 36 weeks, uh, that can be extracted. And let nobody deceive you. There is no drug known to human on this planet that can dissolve fibroid. Please, don't be deceived with the roro they give you in the church. That the oil, if you take this oil, this thing will dissolve. The only drug that we are able to, that people are able to bring up, I don't want to mention names so that I won't destroy their business. Ha, the agent, the component, I mean the compounds of the drugs are usually suppressions of human gonadotrophic hormone. And when you suppress your human gonadotrophic hormone, how would you want to be fertile? Your human gonadotrophic hormones have to do with your follicle stimulating, luteinizing, next, prolactin, testosterone, and androgen. So if they suppresses this, they think it will shrink. But if you have tried it before, you monitor yourself with ultrasound. Periodically, you discover that what you are taking or injection you are taking is not effective. Is not effective. People has been so deceived. I'm talking about don't go overseas to have a fibromyomectomy. So many clients have gone overseas and have problem, and they have to come back to us. That is the problem. The Oyibo man you are going to meet in Europe are not conversant. They are not acquainted with this disease, and it's in surgery. It's something you do very often. Then you can be able to explain and do very better. So in Africa here, good certified surgeons can do it. And if you go America, you go the doctor that can do it better for you. And African American surgeons. I'm sorry, apology to our people in Europe or other Asian countries, including Britain, including the United States. A white doctor will tell you, no. Ask the doctor how many fibromyalgia you have done. If he tell you he has 90, he has done 90, he definitely, most of those 90, he has done this hysterectomy for them. Why? What am I calling hysterectomy? Complete removal of the uterus. Most of them is when we dissect the uterus, we expose the seed. There's a particular instrument we call mammectomy screw. We screw it and we remove it gently. It's not like this. It presents itself like a this tomato. We remove it. It could be many. It could be scattered. It could be two. And I'm measured in weight. We have 6 weeks fibroid. We have some 25 weeks. We have some 32 weeks, even 36 weeks. It can be done, and you will be pregnant. Please, I'm not saying fibroid because of its obstructions. There could be consummation. You can be get pregnant, but there is no space where your uterus can expand and make the baby grow. That's why it's an obstruction problem. Or probably you use this family planning that was not being removed properly. Or probably there's a problem. Like I said, leftover skeleton inside the uterus of the woman. There's a procedure we call uteroscope. Uh, Uteroscope is a procedure you have to examine what is actually is happening within the uterus or the fallopian tube. So when you get inside this machine, it exposes it on the system that inside your uterus is clean. Now, if all these things are done, then your doctor is as good to go. But that doctor must profile you. What do we call profile? Hormonal profile. They will take your blood and do hormonal profile. There are 5 digits that I have to do because most of these hormones that make us fertile, they reside in our serum. Then they will profile you with a woman with the gonadotrophic hormone, which now begat follicle stimulating analysis, luteinizing, prolactin, testosterone, and androgen, and some others hormones. These things have a gazette. They have a number. If you want to be pregnant, the numbers of units you must have is that between 5 to 10, 10 to 5. If yours is less than 5, forget about it. But it has a remedy. Doctor will assist you to either pop you up and make increase your hormone, and you will be pregnant. These are the hormonal problems. Please don't be deceived with all these tablets you take. I'm sorry, I don't have anything but just to mention one. I'm not pregnant. Somebody say I should go and buy one particular tablet. It is stained inside, yellow in color, and the pack is blue. When you take it, those drugs are only used for people who are not ovulating, because you may be fertile and you may not be ovulating. If you are not ovulating, that's when that drug is useful. If you are ovulating and you have obstruction, you went to use the wrong drug, there's going to be a problem. Then that not alone, are you in good health? You must be able to have been able to eat good food and have a proper hygiene. And again, I want to remind women, don't use soap to wash your private part. It always invites trichomoniasis, I mean these toilet infections. Use only clean water to clean your private part, and you will be very all right. I'm sure I've been able to touch your mind today, and you'll be able to do one or two things. Those who are looking for child. Today, we are treating general infertility, both in women, in men. We'll discuss that in the next episode. Thank you.